If you look at many national surveys of states that have healthiest children, most preventive health for children, safest state for children, you'll find that Vermont is usually in the top few names, if not at the top of that list. I don't believe that would be possible without the work of the Vermont Child Health Improvement Program.
VCHIP is a really somewhat unique organization that really sits at the nexus of healthcare policy, child health research, and clinical quality improvement. And being able to work in each of those domains simultaneously to reach the goal of better health outcomes for kids and their families is really exciting. What VCHIP does so well is connect the dots between the systems that are serving children. So there's the policy system, which sets up the structures, but then there are the people who are interacting with kids day to day, the clinicians or the other child care providers. And it's really important that those two entities are communicating and working towards the same goal.
We support VCHIP through a variety of grants to really extend the work that we do at the health department. A huge part of the work that we do is in primary care in particular, and also in that relationship between healthcare providers and families.
It turns out it's not that the quality of the care was in trouble in this state, but there was enormous variability as to how that quality of care was being delivered and what the results were. Let's look across our state at all the practices, see what they're doing, collect that data, try to figure out where the variation is, get best practice to standardize that variation, and then improve upon it and watch and see if our health outcome measures start to improve. And let's share that with every practice, every hospital, every care provider to improve the quality of the care that we're delivering to all children so the outcomes are similar no matter where a child is living.
We noticed that there was a very long wait list for children who needed to have an autism assessment. There was some suspicion that they had some sort of delay, but they really needed to get into a diagnosis. And so VCHIP was able to step in and work with our state partners to provide training. Primary care providers who 2 years ago did not feel comfortable working in autism assessment are now doing that work and feeling confident in their ability to do it. And most importantly, children are getting access earlier to the services that they need.
I think our healthcare system and pediatric practices are really stretched in resources and time, and I think that's where VCHIP really provides that support and scaffolding to both increase awareness what best practices are in medicine and to support, again, those systems changes so that they can incorporate that into their practice.
Our staff has pretty extensive experience in conducting quality improvement in clinical practice in a range of settings, so in primary care, in specialty care, even outside of the healthcare system, and uses that deep experience in order to make measurable changes in child health.
When you look at something good happening to the health and well-being of children in this state, you're probably going to find that the road goes back to VCHIP.
The VCHIP mission is so deeply aligned with our work at the state. It's a symbiotic relationship that's incredibly essential to our work.
Anything we can do to make improve child health, to reduce stressors on families, to really support these early years, to build resilience and sets people on a trajectory to thrive. I can't think of any better work than that.